So it's a nice day outside, and the whole family is walking outside: grandfather, grandmother, and mother, father, and children. All of a sudden, the grandfather holds his chest and he falls on the ground. It appears that he's having a heart attack. Family calls 911, where the EMTs show up and they separate the family from this individual to allow them to work, to allow them to do CPR, and as well as package the patient on the stretcher and put the patient inside the ambulance and leave. EMTs then tell the family to meet the patient at the hospital. EMTs arrive to the hospital, transition the patient. Family arrives to the hospital, is told to stay in the waiting room, and they'll be told further what has happened to the patient. During resuscitation efforts in the emergency department, they were unable to resuscitate this patient. The patient dies. Family is told that the patient dies, and they are escorted to the back of the emergency department where they see their now deceased family members. Um, Today, we're going to talk about why it is better and that common medical practices allow for the family to witness more of the advanced cardiac life-saving interventions as well as the resuscitation attempts. So the old ways, it was common practice to separate families from these medical procedures because it was a belief that this would cause families to witnessing would cause families to have PTSD, to be stressed out, um, and not witnessing would be better for the patients. What we found was this was not true. What we actually found that patients were more likely to be in disbelief that their family members died, and they were anxious while waiting results or being told about their family members. So the New England Journal of Medicine in 2013 conducted a study that showed families who did not witness ACLS had a higher rate of post-traumatic stress disorder and more anxiety than families who did witness the advanced cardiac life-saving interventions. Also, in the old ways, were to separate the family and the patient to allow for the medical professionals to work without intervention from the families. So, in the same study, the New England Journal of Medicine found that families present during the resuscitation did not affect resuscitation efforts, and in fact, it enhanced it because they were then able to ask the patient's family, "Do you want us to continue?" Because it's not likely that it's going to be a good intervention. Um, the American Association of Critical Care Nurses also agreed with this study and went further by saying that if medical companies, the ambulance companies and hospitals, if they were to write policies and procedures in advance, they would have less incidences of intervention, even though intervention from families was very low, according to the New England Journal of Medicine. So another reason why allowing families to witness these advanced life-saving interventions as well as resuscitation efforts is because it shows families that the staff, medical emergency medical technicians as well as emergency department staff did all that they can to save the family's life. So the American Journal of Critical Care did a study in 2014 that showed that witnessing a resuscitation process led to better coping and acceptance that this patient is debilitated or they died by family members. Because you can understand how if you wait in the lobby, maybe these guys can help. Maybe these guys can totally resuscitate our grandfather who had a heart attack because it's medicine, right? Medicine is always supposed to work, which we all know that's not necessarily the truth. So this means that possibly being present during the ACLS and when they call, if they call time of death or if they say this patient is never going to be the same, the family could understand these guys did everything they could to save my family member's life, and they also could begin the coping process. This can lead to also less of a retaliatory response from families. So to conclude, the previous medical process was to separate families from patients when they were in distress. So the new medical practice of allowing patients' family to be present is better because it allows patients to understand that their family member was attempted to be resuscitated but was unable to be resuscitated. It allows the family members to begin a coping process and allows the family members to experience PTSD at a lower rate. Thank you.